Okay, right, good morning everybody, and welcome to today's meeting of Calderdale's Health and Wellbeing Board. We have quite a lot of people on the call, so it's probably on two screens. If I could remind people to put your microphones on mute when you're not speaking, so we don't get any feedback or echoes or hear from anybody's dogs or children, much though they often liven up these video meetings. If people want to speak on any item, as I say, I may not see the full screen, so I will try to see if anybody raises their hands, but the best thing if people are able might be to use the chat function, if you can, to put a comment in chat if you want to come in on any item.
Still got it, all mine's gone. Sorry.
I started.
I weren't seeing you anyway.
Okay. So item one is any apologies and substitutes. Carol?
Hello there. We have had apologies from Chief Superintendent Dickie Whitehead, no other substitutes. Okay,
thank you very much. I'm not aware of any more apologies. Item two, if I can remind anyone if they have them, to declare interests in any items that might arise as we go along. Item three, admission of the public. There are no items to be taken with in confidence, so the public can view for all items. Item four is minutes of the meeting held on the 13th of August. Could I ask if people are happy that these are a correct record, or if anybody has any corrections or concerns, if they indicate now?
Councillor Swift, Helen Hunter has raised a minor amend that, to incorporate, so I can circulate that to members now if you wish.
Thank you. Does it significantly change the point, or
no? It's just a slight. Sorry, it's just a slight alteration of wording.
That's fine. I think happy to take that if you're accuracy. So with that minor amend, people happy to agree the minutes? Thank you. Okay, thank you everybody. Item 5 is question time. Do we have any public questions? I'm not aware of any.
No, there haven't been any questions.
Okay, so we don't have any questions. So item 6, first of the major items, is about the personalised care programme and carers programme. And I think we've got 2 or 3 people going to present on this. I think we've got Karen from Locala, Fatima, and I'm not sure if there's someone else to comment on this as well. So can I just check who's leading off on this one first? Is that,
well, just very briefly, myself.
Oh, Steve, sorry.
It's okay, it's fine. If Fatima and Karen are comfortable with that. Yeah, just a few words of introduction before Fatima, who hopefully has had, there's a PowerPoint presentation, number of slides to be able to share, and then some questions for the Health and Wellbeing Board. And we're very grateful actually that this has been prioritised on the agenda, and also it's been put right up to the top as because of course, if ever personalised care and the way that we support unpaid carers was important in our health and care system, with the current challenges of accessing care, accessing support for patients with long-term conditions, needing updates and refreshers of their care plans, and of course the 21,000 or so unpaid carers that really hold the system together. It dwarfs the staff workforce several fold. So it's so important that in these challenging times we offer every possible aspect of support to staff to be able to deliver personalised care. And Fatima will explain a little bit more about what that really means in practice, but also how we can support our much valued carers, unpaid carers in the system. So now Fatima, I don't know whether Fatima has vanished, because she was glowing green, and I think we may have lost her. Have we lost her? I think we have. Carol, is she still on the call?
I'm sorry, I can't see her.
I think
There she's
Bye-bye.
come. She's
just
back.
joining.
just
She's just
coming
here.
back. Zoom,
Gosh,
Zoom
that's how to give a GP a panic attack. Lose your main presenter. So I'm so grateful that Fatima's managed to get her way back in. She always stands out from the crowd. I've always said that. And actually she does indeed today with her green and yellow glow. So without further ado, I'm going to hand over to Fatima to really take us through some slides and then some questions for the Health and Wellbeing Board. But thank you very much for giving us priority place on the agenda today.
Can I just check that you can all hear me?
Yes, we can.
Yes, we can hear you.
Yeah. Sorry, I'm having quite a few technical difficulties this morning. Apparently my internet connection as well as my sanity is currently unstable, so please bear with me with this. So I'm just going to attempt to share my screen, and I'm really sorry that I'm not going to be able to repeat what Stephen was just talking through, but my presumption is he was sort of giving a brief overview about the importance and contribution of both the personalised care and carer programmes, particularly now more than ever because of the current pandemic, many of us have experienced. We thought it'd be really helpful just to talk you through the purpose and rationale behind both programmes, but also the opportunity that comes with them both coming together. So just bear with me while I attempt to share my screen because it's now not letting me do that.
I've given permission to share screen, so you should be able to.
Can I just check you can see that?
Yeah.
Yes.
Okay.
Yes. Yeah.
So for those of you that aren't very familiar with personalised care is very, very simple. It's just about understanding what matters to the individual that you're providing the care and support to. And that can be for many reasons, and there are many positive outcomes that come as a result of that. It can be an improvement to their health and wellbeing, making the best use of a finite health and care system. But most importantly, the quality of care that they receive improves significantly, and they're very, very happy as individuals, which is what we want. Obviously, prior to the impact of COVID-19, there was significant reference to personalised care within the long-term plan, which is the NHS strategy of what they're aspiring the health and care system to look like in the future. And there were some very great examples of significantly impactful personalised care approaches, which really ensure that people with long-term conditions are offered care that is meaningful to them, which enables them to be empowered with the skills and knowledge to manage their own long-term conditions. And I just sort of want to just give you a brief example of being in somebody's shoes with a long-term condition. We're all adults and we don't like people doing things to us. We quite like to have the information and the knowledge and the skills to be able to care or sort it out for ourselves. And our health is just the same. But quite often, because of the way in which we've designed or delivered services, we don't always consider the fact that actually the person that we're providing that care to would really benefit from having some skills, some expertise, some knowledge, possibly from the voluntary community sector or other areas, to really enable them to take ownership of their health and well-being themselves. And actually, now is the best time to have that conversation, because COVID has really enabled people to really focus on their health and well-being and to recognise that actually their relationship with the health and care system does need to change, because it won't be provided in the way it was done previously. So this slide for me is a really, really important one that just articulates briefly why supporting personalised care is important, the sort of socioeconomic case, as well as just the ethical and moral one, really. For example, the mortality gap between women and men is around about 7 years. But actually, if we empower people to support themselves, to look after themselves in a way that is meaningful to them, that maybe takes into consideration their religious and cultural needs, we can really address that. We can really address the fact that within our region, for example, people with learning disabilities have a lower life expectancy than their counterparts. And also, and this one was a real shock for me, people who are receiving information and advice about interventions often receive information that says their uptake or high risk is actually reduced by 20%. So sometimes medicalisation is not the solution. Sometimes personalisation is the way to go. And there is a cost saving implication as well. The average savings around about £1,300 a year, which, when we're thinking about getting the best use of public funds, for me, is a significant factor about why, you know, using personalised care is the right thing to do, as well as the, you know, the barn door obvious thing to do. So one of the fundamental things that I've been talking about a few times is the importance of changing the relationship. And we are in a climate right now where COVID has brought to the forefront the impact of health inequalities on certain communities, where some have been impacted more than others. I'm just going to magnify this so you can see it a little bit better because it's a little smaller on my screen. And what's really come to the forefront is actually that there is an opportunity with personalised care to really change the relationship between the health and care professional and the individual by enabling them to make informed decisions, by recognising that one pathway doesn't necessarily suit everybody, that actually if they do have the knowledge and the skills, they can share that knowledge, they can be peer influencers and support other people across our communities with the skills and knowledge they develop to help them take ownership of their health and well-being as well. And just giving you one example of where this has been really effective. There was a scheme in Kirklees where several taxi drivers got together who were suffering or were living with diabetes, and actually them supporting each other, providing that peer challenge, sharing the expertise of practical things like, you know, recipes to help people manage their long-term conditions, that, you know, that encouragement to sort of, you know, exercise, go for a walk, don't spend all the time within the taxi, was far more impactful than some of the one-to-one outpatient sessions that we were seeing. So actually there are numerous examples, not just nationally, but within West Yorkshire and Harrogate, of why this is so important. But in order to do that, as health and care professionals, we need to actually let go of some of that power and actually enable our workforce to think a little bit more creatively about the way in which we normally deliver health and care to our patients. I'm just going to check that you can all still hear me because I'm still getting the signal that my internet is unstable. Thank you, Stephen. So obviously we're now in a situation where COVID-19 has significantly changed the landscape in which we're operating. I'm sorry, I didn't catch that. Okay, I'll continue. I thought somebody was asking a question then. So we're currently in the middle.
Wasn't muted.
Thank you, Councillor Swift. And one of the key things that we're thinking about in the second wave and how we prepare going into winter particularly is how we can make the best use of our health and care resources, but also ensure that the people that are most vulnerable in our communities are still getting the care and support that they need. And for me, I think personalised care comes into its own at this point. So, you know, just to give you a couple of examples of how personalised care can help COVID-19, the first is, and I've mentioned this already, really enabling us to provide bespoke care, really recognising what matters to the individual, who matters to the individual, and what motivates them. And I think if we get that right, it will really enable us to focus our finite resources to the areas where it's most needed. The other bit is really building people's personal resilience. And I, as somebody with a long-term condition, really found it important for me to have some control, to really realise what is it that I needed to do, and to have some peer support to support my resilience in managing that long-term condition. But what's also important is building that across communities. The communities quite often, and I'm sure Deepika from from CVAC will support this, are able to take care of themselves. They just need the resource, the opportunity and the power to do that. And actually personalised care enables communities to really go with that in a much more transformative way. It also supports people to live independently and increase their levels of well-being. And we're seeing that not just with the usual medical conditions, but things like depression, social isolation. There are a number of things through personalised care that we can do to support individuals who are facing these really challenging times with increased anxiety, mental health concerns, feeling lonely, feeling scared, to really increase their well-being during what will be quite a challenging period going forward. And I've also mentioned the importance of being able to self-manage. So one of the things that we have been doing, and I'll talk through it very shortly, is the investment in not just the usual ways of supporting people, so apps, social link workers, and really creating different ways by which people can access support at a time and a place that is meaningful to them, and giving control back to the people. And the final bit that I wanted to really emphasise is that if we really want to prevent deterioration and unnecessary service utilisation, then we've really got to integrate our services and promote those strong local relationships that we've already got in Calderdale, building on the fact that the care is surrounding that individual rather than them having to go and seek it out. So just before I bring in some of the questions that I wanted to open up the discussion with the board, I just thought it would be really helpful to just bring you a bit of a brief update on where we are with the Carers programme, because I do think there are some interdependencies between the two, which was one of the rationales behind bringing the two programmes together. And I think one of the first things, and as you know, or most of you know, when it comes to meeting me, I always talk about money first, because that's always a concern for many people. Supporting carers has always made moral and social sense. We know that because the data speaks for itself. But I think what we're seeing more and more is the fact that it does make socio and economic sense as well. So, you know, prior to COVID, we were estimating around 9 million carers in the UK by 2037. That's out the window now. We know that as a result of COVID, probably roughly 1 in 4, according to Carers UK, are balancing caring responsibilities as well as facing the impact of the pandemic. That will have significant implications for people personally with their physical and mental well-being, as well as their financial situation, particularly if they're unable to work because of their caring responsibilities. We know that 2/3 of carers have told us that they're quite often subsidising their caring responsibilities with their own income, because unfortunately some of the services that were available previously, because of different circumstances, are now currently unavailable. And the other thing, which I think is really concerning, and those of you that were watching Calderdale last night will have also seen this, the number of young carers has increased. So we've got carers as young as 4 in this region providing care and support. And as the mother of a 7-year-old, I mean, just imagining my son providing care and support. I mean, he's useless anyway, but actually, you know, having to take responsibilities like cooking, personal care, providing medication, etc. I think, you know, it's just nothing a mother would want for their child, but sometimes circumstances don't enable that. And children are put in situations where they're having to step into the breach. My argument has always been, and I think we are seeing that very much so with the delivery and impact of the Carers programme, that, you know, supporting carers with investment is an enabler. It does save the system money. It prevents admissions, it supports effective discharge, and also actually prevents both the carer and the person receiving that care and support from needing help and care themselves. I mean, you know, one of the reasons why I'm so passionate about this agenda was my own health was impacted directly as a result of my caring responsibilities. I now require lifelong support and care, which probably could have been prevented if the system intervened at the right time and supported me like we are doing right now. The final thing I will say is on this particular agenda item that, you know, 1 in 5 of the NHS prior to COVID was balancing work and caring responsibilities. 1 in 7 within the public sector were balancing caring and responsibilities. As you can appreciate, that has increased as a result of the COVID pandemic. What we've done as a programme is really pushed hard good models of practice to support people balancing their care and responsibilities with our Working Carers Passport. That has been nationally recognised. We won the HSJ, which is a Health Services Journal Award, National Health Leadership Award, for the work that we were doing. And NHS England have actually adopted our model as a bespoke good practice and something that they're implementing as part of their workforce plan across the system. So supporting carers does make not just social or moral, but economic sense as well. And it leads me really nicely to sort of the first discussion question, which is I've talked very much about West Yorkshire and Harrogate and the work that we're doing. And it very much links into the work that's been supported by our health and care organisations in Calderdale. But what I'm really keen to understand from our Health and Wellbeing Board colleagues, particularly our elected members who've got their finger on the pulse of the grassroots of Calderdale, is what do you think are the key issues regarding supporting our carers at the moment, as well as the potential of personalised care, and what do you think would be the things for us to consider moving forward? So I'm just going to pass back to Stephen to sort of open that conversation and take us from there.
Thank you, Fatima. So yeah, I think it's over to the board really, just to think about what do you think would be ways in which Calderdale, we can learn from what's going on in West Yorkshire, but what are the real needs of the carers, unpaid carers, and how we can make personalised care, part of the way that everybody is delivering care and working out and engaging with patients, with the public, with families about what kind of care they would like to receive, particularly during these challenging times. So any thoughts from members on either of these two agendas?
Yeah, could I make a couple of comments, Stephen? I mean, this is in the context, firstly, of saying that actually I completely agree with an awful lot of what's said about the importance and value of personalised care. And I think particularly, and it's something from I always felt, going back to time working with older people when I worked for Age Concern, there is always a danger of a medicalised or social care model of support that basically works from telling people what they need rather than starting by listening to what people want to do. And I guess the key advantage of personalised care is it fits very much as your gender about how do we enable people to live the fullest life possible, and therefore focus the support on enabling them to do the things they value and want to do, rather than sometimes the things we tell them they should be doing. I think my concern, I suppose my challenge back is just a bit about health inequalities, because again, I recognise if you get it right, again, you can do the right thing for people based on their individual needs rather than have a standard package that everybody has to fit into. But my concern about anything that depends on personal choice is that there is always an inherent bias towards the well-informed, the middle class, the well-connected. I think about the choice agenda in schools. So how do we genuinely make sure that we get the advantages of personalised care in terms of health inequalities and actually don't create a system that lets the people with the sharpest elbows get the best deal?
That's a very difficult and challenging question to come back to, I think, but we'll give it some thought, and no doubt other members of the board can think about that as well. So maybe we just pick up a few comments and then we can have a think about how we might address some of those.
That's fine.
I think Helen, sorry, Tim. I'll hand it back to you to chair it. Actually,
it's all right, Stephen. Sorry, yeah. Helen and then Bob. Yeah.
Good morning. I just wanted to reflect on the fact that I think something that we detect as Health Watch and people talk to us about is the fact that in Calderdale, because Calderdale has a small population size by comparison to its area, obviously, that actually there aren't a particularly large number of specialist services available for people in this area. So if you have a condition that perhaps isn't particularly highly prevalent in the population, very hard in an area of this size to justify having a specialised service to work with those people. But actually what that often means is that when we talk, so I'm mindful of the conversation about personalisation and there being lots of barriers that are potentially thrown up for people where it's like, no, we don't work with people with that condition, we don't offer support to those people because you don't fit in the remit of this service. And I think there's something that's a particular kind of Calderdale issue in terms of how we make generic services as accessible as possible for people who might have quite specific needs, because they aren't able to get the specialist support. So we need to make sure that the generic support is open and accessible and responsive to some of those more specialised needs.
Would you like to respond to both of those now, Councillor Swift, or do you want to take a couple of more questions?
Do you want to bring Bob in as well and then respond? Yeah.
Yes, thank you. Good morning. A bit of a difficulty for me because I've an interest in this area. Of course, most people will understand and know that I am a full-time carer for my wife Margaret, who has Alzheimer's, and so obviously we've been on a journey from getting diagnosed through to where we are today, and the importance, obviously, of me being available as a personal carer is extremely important. Someone, obviously, to be able to do that and try to keep other interests going, like today, talking to you here today, and my work on the council. So it's difficult, and we do need all the support. Carers do need all the support they can possibly get. I suppose Councillor Swift just mentioned that some people obviously can access this kind of assistance and help more than others. I suppose certainly I can, because obviously with the connections I have through adult social care, but it is a difficult journey. I've recently, I'm a board member of the Colesdale dementia-friendly community. It's been set up last year. It should have had a launch early in the spring, which was cancelled because of COVID. We're trying now to get probably a virtual launch. I've recently recorded a video describing our journey as a carer, just to try to go through some of the points and things of concerns and go good things that happen to us along the journey, and just finding how our services are accessed and being able to use. So it's quite complex, and it really wants that integration and assistance from social workers and from others to help people who are carers or becoming carers for the first time to navigate. So it's all about how to navigate what's there and what's available for them to help them. That really is important. I'm not sure all the links are in place for that yet for people. There are some great things out there from the voluntary sector, and things like memory lane cafes, which are really, really, really good and really important for people to go to enjoy. And so obviously every carer has different challenges and concerns and issues. No one carer will be the same. So really welcome any steps along the way to improve personalised carer and the assistance and help that carers can get.
Thanks, Bob. Fatima, could I suggest you come back in on the comments we had so far, and then I've got 3 more people want to comment, which we'll take in another batch, okay?
No worries. Thanks, Councillor Swift. So the first one about health inequalities and how do we enable choice, I think is a really interesting question. And I think one of the key things that we're trying to do is make sure that we're working alongside the workforce. And the next half of the presentation will talk you through what we're actually doing, because obviously we were just giving an overview of the approach and strategic view. I think we have to really move away from necessarily looking at the individual conditions to seeing the individual and how the condition impacts them and what will enable them to take care of that condition in the context of their personal circumstances, what impacts them, what motivates them, who is important to them. So I do recognise, and I totally agree with the point, Councillor Swift, about the fact that actually to address health inequalities, we need to think really creatively about how we ensure that one size does not fit all, that we're taking into consideration the specific needs of the individual, that actually some specialist conditions will require some bespoke interventions. I think one of the absolute joys of working in an integrated commissioning system is that ability to tap into stuff from other areas as well. So what we're really trying to do is create a myriad of support across the region. So if we haven't got the solution available within Calderdale, for example, might be able to pinch it with Pride from Leeds and vice versa. So it's very much about an evolving process, and we are very much at the start of a journey as well. So yes, I'm very much offering the world, but we're not there yet. It will take time, it will take resource, and it will take quite a lot of hard work actually, because we need to change the way that we've instinctively been providing care. But I do think working alongside the amazing population health programme, which has got a health inequalities network, and Sarah Smith is phenomenal when it comes to this piece of work. We've been working together really well on this. I think we will be making some leaps and strides to address that. So I just wanted to alleviate your concerns on that specific point. I think your question, Helen, about specialist conditions and about the fact that there are, certain people, across not just Calderdale, but other parts of this region that have got certain specific needs and will need certain bespoke interventions. I think my answer will be a similar one that I've just given previously. We're now living in a health and care system that is beyond Calderdale. We need to use the best of that and to use that to our advantage. So I'm very much keen to hear how we can support that. And as you know, I'm not shy in coming forward to ask you specifically what areas, because we can work on that together and make sure that we support people in a way that is meaningful to them. And you shouldn't be at a disadvantage just because the condition you've got just doesn't happen to be a very common one. I think your situation, Councillor Metcalfe, is something that personally resonates with me. I mean, I was somebody living with dementia for 10 years. I can't imagine how challenging it is right now in this current circumstance to be looking after somebody living with dementia. The balance between maintaining their dignity, their independence, and keeping them safe during a pandemic. I take my hat off to anybody working through that right now. I personally welcome the work about dementia-friendly communities. I think that's a really important initiative to support carers looking after somebody with dementia, to make sure that wherever they go, whatever service they're interacting with, whether that's a health and care or beyond, is enabled to be as accessible as possible and as comfortable as possible for the person living with dementia and their carer. I think one of the key things that we've tried to do as a programme is really push the awareness agenda, because I think many people don't fully appreciate the challenges facing carers at the moment. I think they are very much the unsung heroes of society. You only have to look at the news coverage of the last 6 months to see that carers weren't mentioned very often. When we were applauding certain key workers, carers weren't often included in those conversations. And actually, as a society, if we didn't support carers, the health and care system would collapse. There is no question about that. And one of the things that we've tried to do as a system, and we're very, very lucky to have the support of Dr. Colesdale and Karen and Robin actually, is really push the agenda to embed it as this is part of the fabric of our society. This is how we live, and supporting carers is part of that. But I think what you're alluding to is an additional dimension, which is that carers of people living with dementia have specific needs, as do people living with dementia, and that we need to think more creatively about how we support them in meaningful ways. So some of the things that we're doing in the short term will be, for example, a dementia charter, which will be how we support people that are caring for somebody living with dementia who are accessing our hospital services, for example, because I know from personal experience that can be fun. And also how we support people in wider society as well who are challenging that, complex landscape of the health and care system. And one of the things that we did really quickly during the COVID pandemic was the Carers Toolkit. So one of the things I always say about my journey when I became a carer was there was no light shining upon me and no one gave me the holy book of knowledge of how to be a carer and deal with all the challenges of navigating the health and care system. But the Carers Toolkit, I think, is a very finite but bespoke resource, and we were giving it through all the discharge coordinators of our acute trusts. So, for example, Calderdale and Huddersfield Foundation Trust were phenomenal, as were Mid Yorkshire and other acute trusts. And within that pack was some very simple information about how to stay safe during COVID, information about how to get local advice from, for example, Calderdale Cares, but also, very importantly, a carer ID letter. Because one of the things that we were hearing quite a lot from carers, particularly those of caring for dementia, was that they were trying to keep that person safe. They were taking them out and about. They're trying to take them shopping, and they were being challenged trying to care for that individual, and they needed something bespoke that identified them as someone with caring responsibilities. And again, the joy of working in a health and care system is we have the power of the NHS behind us, but also the power of the local authority. And we were able to very quickly get that letter out as part of the toolkit, and it's available online. So my answer is, we've got a lot of work to do, so much more. But what we've tried to do is where we can respond at pace, but make sure that we're responding in a way that's bespoke to the needs of the carer, because not every caring situation is the same, as you rightly point out. But we've got so much more to do. And if we can help, or if you can help us, I'm not shy in asking for that, as many people will tell you.
Thanks, Fatima. We've got 3 more people who want to contribute. Now I'll bring you back, and then I'm aware there's still more to the presentation. So after those, we'll move on to the next part of the presentation, if that's okay. So I've got Councillor Megan Swift, then Councillor Adam Wilkinson, and then Deepika. So Megan.
Hello, everybody. Can you hear me? No?
Yes.
No, we can.
Yes. I'm sorry. I'm having difficulty with the thing. So sorry. I mean, everybody admires carers. They do a terrific and absolutely wonderful job. My concern about carers is they can burn out like anybody else. And under the pressures that they're in, that does seem, quite likely. And it's not just adults, it's people who are caring for children that have different issues. There never seems to be enough, what's the word I'm looking for? Come on, Adam, remind me. There never seems to be enough opportunity. Children go sometimes to Linden Brook, etc. But adult parents, adults altogether, don't seem to have much support as far as carers and getting a break themselves. So I don't know whether that is something that carers are supposed to look after themselves with, or whether we do give some support for it. I've finished, thank you.
Thanks. Adam?
Just to come back on that point that Megan's made, yes, I have been made aware of a number of families who have struggled, particularly during the pandemic, where the normal sort of support that's in place for families is it's not always possible to provide the same level, and that is something that I know Julie is looking into with public health colleagues to see if there's anything more we can do with, particularly with families with children who have high needs. I was just going to make the point, just to come in about young carers, and obviously we have the Young Carers Service, and there's thought to be 1,500 young carers in Calderdale, which is a huge number. And to hear that some of them are as young as 4, it's just it's unbelievable, really. And again, you can only imagine that the pressures must have increased on those families during the pandemic. When we talk about personalised care and engaging with carers and families, I mean, going through the Young Carers Service would seem like an obvious way to sort of engage with those young carers. But the thing that, the question I have is that I believe we're only in contact with about just over 200 of the young carers in Calderdale. So that leaves about 1,300 nearly that we're not in contact with. And I guess for me, it's how do we make sure that we're listening to their needs and responding to them as well. Thank you, Chair.
Thanks, Adam. I'll bring Deepika in. I'll bring Julian on those couple of points about children after Deepika before I come back to you, Fatima, if that's okay. Deepika.
Thank you. I think there's a number of challenges here, isn't there? But I think as Fatima had alluded to earlier was, we have an integrated system, and I think that's really positive. And there's something about how we also make sure that we're encouraging and supporting how we keep those more informal support networks going. I think peer support within certainly the carers circles are really, really important for all, people from all communities, backgrounds and ages. There's something about making sure that people have the right information, and also making sure that we are connecting people to community hubs or online support. But I think for me the critical element is prior to COVID, we were certainly hosting carers groups in our building, and I'm aware of other carers based and dementia based groups and organisations as well, supporting a range of carers. But some of that and a lot of that has stopped in the meantime. So my concern is how do we continue to how do we find out what's stopped, and how do we make sure that we enable those groups and networks to get back on their feet again. I think just a couple of other points as well was making sure that we as Calderdale continue to hear those voices, whether they're positive or negative in terms of what's happening at a local level, and we're continuing to evolve and make changes in line with that. The biggest concern, as Councillor Swift alluded to earlier as well, is inequalities, and particularly the lack of presence of BAME communities, particularly around some of the carers groups I've joined or been visiting to make sure that they're as inclusive as possible. And I think Calderdale Cares has a role to play as well in the whole agenda around how do we support carers, how do we make sure personalisation is embedded across how we work and how we kind of operate as a system. So in my view, it is really about how do we create those support networks, because I think those have an equal weight to the system efforts as well. Thank you.
Thanks, Deepika. You're very quiet, by the way. I don't know if that's something you can turn up if you speak again, but probably your microphone. Julie, I think you just want to come back briefly on some of the children's issues before I go back to Fatima and move on to the next section.
Thanks, Councillor Swift. Yes, I just wanted to pick up on Councillor Wilkinson's comments around young carers and looking at the number that are in the borough. And as Councillor Wilkinson said, we do have a specialist team that work with young carers, but they can only really do that intensive work with those who are at the top level of need. So they're working with about 10% of those carers. What we've done to address that, because we know identifying young carers early and that early help and prevention offer is so important, is that we've done a lot of work with schools. And we've set a bronze standard and a gold standard, silver standard that they can aspire to and work with, because about 40% of children who are in school, nobody knows that they actually are a young carer. So this is about a caring, supportive, early approach to really have that understanding if children are coming in late, the homework is not done, they're juggling with what's going on in the family home and their education is suffering, that teachers are aware and other pupils are sensitive to that and supportive. So I've been up to Ling Bob's school giving out an award and done a whole assembly up there with young people, and they have little worry boxes, you know, that young carers and other children can use. So there's lots and lots of work going on in schools just to reassure you that we do identify young carers from that early prevention level across all schools in Calderdale, and the young carers team do that outreach work as well as supporting the most complex young people as well.
Thank you. Fatima, I don't know if you want to come back on in those that's covered, or then want to move on to the next section.
If I may, Councillor, that would be really, really helpful. Thanks, Chair. So the first question from Councillor Megan Swift about our carer burnout and about opportunity. Very, very cognizant of carer burnout, very mindful, particularly of parents with children with special educational needs. There were some horrific stories that was coming in via the different social media mechanisms that I have that they've experienced. Like I said, that was one of the reasons why we developed the carer letter. It's one of the reasons why the toolkit was turned around so swiftly, because we could see that carers were really struggling, needed to provide some practical interventions to support them. I suppose my sort of departing challenge to everybody in this room is you are all people of influence and power. You all have a role to think carer and to utilise your influence to help these people that are really struggling, because they will burn out, as Councillor Swift has rightly pointed out, and they are very, very close to it right now. And as we head into winter, we will see the implications of that. But obviously, I wanted to also provide assurance that as a programme, we are working really, really hard with our partners across the system to provide those really practical interventions to support carer for as long as they possibly can. You know, when we're talking about carers, it isn't just people that are living in the same property. You know, there are people that are caring for people in care homes. There are distant carers. I'm caring for somebody in South Yorkshire right now. It's very stressful. And it's just about how we can support people in all different ways, whether it's when they're working, whether it's via peer support, or whether it's just about providing that emotional mental health support for people just to keep them going and to enable them to maintain their resilience. In regards to sort of opportunity for young carers, we've done quite a lot of work in the last year, really pushing the fact that young carers have got a skill set that is really transferable into the health and care system. So we have got significant workforce issue, retention issue, recruitment issue, and yet there is a cohort of young people who have got the personality, the skill set and the experience that is really transferable into our health and care sector. Why are we not shouting about it? Why are we not being more explicit about the opportunities that are available to them, and also investing in them to come and work for us? So one of the things we did last year was a roadshow supporting our young children and young carers to experience the different types of opportunities in the health and care sector. That went really well. The feedback was amazing, and you can see it on our website. And it's really encouraged them to think about vocations in health and care, because their skill set is an asset rather than the disadvantage that they feel they get as a result of caring, because their academic attainment is lower than their counterparts. I think the other thing I will say about supporting carers is Calderdale is one of our sites when it comes to personal health budgets. So they've really invested in some practical ways of supporting carers, either financially to use that money in a way that is helpful, whether that's paying for cleaning, whether that's paying for a rest, whatever it is, it's giving that control and autonomy back to the carer, which is really, really crucial. In regards to young carers as well, I will say Calderdale is one of the exemplars when it comes to supporting our young carers. There are some great models of practice that we have, shall we say, pinched with pride. What I will say is when we've engaged with young carers and we have a whole work stream and programme devoted to our young carers, they have often told us that they don't want to be known to services. They don't want to engage with services. What they want is practical interventions and support to help them continue to care. Things like, as Julie's rightly alluded to, homework extensions, having their phone in class, being able to not have to explain their personal circumstances all the time, and really just having that supportive network around them rather than them having to engage with a statutory or not so statutory service. Also, some of the work that the VCSE have been doing supporting our young carers has been exemplar. And we're really grateful to lovely Robin Tuddenham's programme that's given us some investment to address some of the health inequalities being faced by our young carers. We're using that to currently recruit somebody focused on solely supporting our young carers across the region. They will be working with our children's services and our schools, the Education Directorate particularly, to really embed things like an assembly pack, just to promote awareness amongst our young children and our young people that carers exist and their contribution, practical interventions for teachers to support our young carers, and also just a way in which sort of a model that people can follow with some practical interventions to support our young carers. So I really want to assure you that although I'm painting a very worrying picture in regards to the carer situation, we are doing a lot of exemplar work, nationally recognised work actually, to support carers in a meaningful way and in response to what they're telling us they want, because we've got to listen to what they're telling us they need, as I'm sure Helen Hunter. The final point before I end, Councillor Swift, is BAME carers. I'm really glad, Deepika, that you brought it up. We are very, very concerned about the social and cultural connotations of caring. So just flagging the fact that not all BAME is the same. Obviously, we recognise there are different needs for different communities. What I will say is, particularly within the South Asian community, we're really mindful of the real significant pressure, particularly put on by extended families or living in one property, cultural expectations that caring is not a choice, it is your responsibility to do it, and also real cultural expectation that you should not ask for support from services. And one of the key things that we're wanting to do in the next year, COVID kind of scuppered it a little bit and we need to think a bit more creatively about how we do it, is working alongside our peer influencers and the grassroots of our communities to have some really powerful conversations and to call it out, because it's unreasonable, it's unfair, and it's not sustainable for our communities to be operating this way. It doesn't mean that you're not looking after your loved one if you access some service to help them. And actually, one of the key messages that we've always tried to say to our carers is, if you're maintaining your health and well-being, you're taking care of yourself and your loved one, because if you don't and you're not here, who is going to look after your loved one? And I'm going to stop there. I could talk all day about this, Councillor Swift, but I'm mindful you have other business.
Thank you, Nurse. It's been a really important agenda item, and yeah, but also, you know, it's valuable when people are so obviously passionate about the work they're doing as well, and you know, for so many people it comes from lived experience as well. Stephen, do I need to come back to you? I think there was a bit more of the item. Yeah.
No, that's it. Just very briefly, I think I just wanted to thank Fatima for her energy, her passion. I think in today's discussion, more than ever before, we've seen the value of being part of the ICS, the Integrated Care System, and thinking how on some of these really challenging, wicked issues, we can learn from the partners around West Yorkshire and Harrogate, and really, as Fatima said several times, pinch with pride. But I think we are punching above our weight in Calderdale. There's a lot of great things happening. But I think for this Health and Wellbeing Board, apart from raising awareness, and it's back to the challenge of what can we all do then? What contribution can we all make in our organisations or as elected members? As Fatima said, knowing, you know, what the pulse is on the word on the street, how we can promote these programmes, how we can embed the learning and make sure that everybody that's a carer realises that they have an opportunity to receive more support than they're getting at the moment, and that the people that really need personalised care are those vulnerable members of our community, and that we challenge health and care systems or organisations to reach out proactively to those individuals and offer them effective personalised care packages.
Thanks very much, Stephen. So yes, I'd echo your thanks, Fatima, for the presentation, for the work that you're leading here, but also, you know, our appreciation for all those people who are caring and providing such invaluable support in the community. And I'm sure COVID has made that much more challenging for so many people. And of course, we will see ongoing impacts as well with new people finding they need to cope with people with new conditions as well as a result of this. So really important item, and thank you very much everybody for your contributions on that one. Which brings us on to item 7, which is COVID. I've circulated with the agenda paper quite a detailed update, and before I bring anybody in, I mean, I don't want to ask organisations to repeat everything that's in there, obviously, but perhaps to pick up one or two key points from the discussion that we've had so far. Perhaps Debs, it's perhaps quite sensible to just sort of start with a bit of an overview about where we are at the moment.
Yes, thank you, Councillor Swift. Yes, so we've got, as I've said in the short update, unfortunately, since the beginning of September, we've seen increases in COVID-19 rates right across Calderdale. Unfortunately, in every part of the borough, in every age group, and our rate, is increasing every day. At the moment, for the latest data, it's 243 per 100,000, and that puts Calderdale 52nd on the list of local authorities, and unfortunately that's not because Calderdale's improved. Unfortunately, it's just because we're not deteriorating as quickly as some other areas, and I don't think I need to say much more, Councillor Swift. I think the key issue is that this virus now, unfortunately, is right across the borough. We're finding cases in all settings, and it's really, really important that we all play our part. And I think, what we need to do, whatever the restrictions are, whatever the rules are, I think we all have a role in taking as much responsibility as we can to limit contact with other people at the moment. I think the second thing that's really, really important is that people that have got symptoms of COVID or who have been told that they're a contact of someone with COVID really does need to self-isolate for the period of time, for the whole period of time. So that's 10 days for somebody that has symptoms or as a positive test, and it's 14 days for somebody that lives with them or who's been told by NHS Test and Trace or by the setting that they're a contact. There is now support available for people, financial support available for people that are self-isolating, and also through our community hubs and through our fantastic voluntary sector. There is support for people that are self-isolating, but that's so important because that's how we break the chain of infection. If we isolate the people that have either got the virus or been exposed to the virus from everybody else. But as I say, we are seeing impacts, and I'm sure colleagues in our NHS partners will talk about the impacts that we're starting to see in hospitalisation. So I will leave it there, Councillor Swift.
Okay, thanks. So I don't want to bring in every agency unless there's something to update, but I think it would be good to hear from both Anna and Neil about just what the headlines of what we're seeing in terms of health impacts. So can I come to you first, Anna? Yes.
Sorry, I was just trying to unmute myself. Yes, reflecting the prevalence in the population, we've seen increasing numbers of patients being admitted who are positive with COVID to hospital. Our current numbers are 40 inpatients currently positive with COVID, 6 of whom are being cared for on ICU. We're also seeing increasing challenges around staff impacts of self-isolation, which means at the same time that we're seeing an increased admission rate for our patients, we're also facing increasing challenges around our staffing levels as well, which we're managing. We are currently continuing to maintain the restart of elective services. So all taken all together, I would say there is some significant pressure in keeping those services going safely, which we're managing at the moment. And you'll know we have, with partners, put some communication out about choices people can make instead of, if they don't require hospital, of accessing services in other ways. So I'll stop there. Any specific questions I'll try to answer.
Thanks. And in terms of private care, I'm not sure whether this is Neil or Stephen wants to comment.
Yeah, well, excuse me, I'll comment and then Stephen may come in. So I think we've recognised the sort of the impact on the hospital, and we're working with partners with Ian and Anna around sort of a local escalation policy, and we've implemented some GP support to help with the flow in hospital with discharges. We're not seeing a similar impact on primary care, whilst there's clearly workforce pressures and keeping COVID safe in general practice. We've only had a couple of outbreaks in practices lately, but it hasn't impacted on the delivery of services to a great extent. We have been really proactive with the hospital and other partners in the last week or so on comms around making the right choices, and that general practice is open and pharmacies are open to try and divert away from A&E. And we've had huge success in the sort of people seeing that, and whether it's had an actual impact or not, we're not really sure, but we are seeing great coverage in people seeing that. So over 100,000 people have seen that on Facebook and Instagram over the last week or so, which is good coverage and best that we've had for a while. We are looking to sort of do further around general practice access, and we're working around understanding how we can mitigate some of the noise that there is around access to general practice, and we're working very closely with general practice to improve that and to recognise all the models of access to primary care, and how you can get swift access, but recognising there are a few bottlenecks. So we're not seeing huge outbreaks, but continue to sort of work and improve on what we've got.
Thanks, Neil. Stephen, was there anything to add to that cover?
Just very, very briefly, because I think Neil's touched on just about everything I was thinking to say anyway. I think the main challenge is just that it just feels very different for the public and for patients, and how to navigate around the system. Are things closed? Are things open? How do you get in? How do you contact? Online, telephone? What will the appointment look like? Is there any point? Should I go and see the doctor? Is care still available? These are the main challenges, and I think we just need to work out how do we engage and work with our population in Calderdale to say that the NHS and care services are still available, but how do you navigate through and get what you need when you need it? And it's really, really challenging at the moment.
Thanks, Stephen, and thanks for recognising that. You'll know that Megan and myself have raised a few cases around that, and we do understand the pressures. The big issue is phone systems, isn't it? Really, how do you make a phone system that's friendly? I think, I would say if people can use it, the GP online thing, I've had reason to use that a couple of times recently, and if you're confident in using it, it's great actually, and gets through very quickly, and it does take the pressure away from the phones. But that is the big challenge, and I think it's important, and it's same in terms of access to hospitals as well, isn't it? Because I do feel that some of the kind of support for the NHS that was present at the start, is getting a bit muddled in some people's frustrations about getting through the systems as well. So it's really important we get the messages over and support you, but at the same time recognise we need to make sure people are getting access, particularly when they're critical. Noted your comment, Adam, about community pharmacists, and asked Carol to pick that up in the declaration of interests in the minutes. Caroline, do you want to come in?
Yeah, I just wanted to highlight the concerns. Although we're not seeing challenges in terms of being able to provide services because of outbreaks within practices, I think it's important that the Health and Wellbeing Board is aware of the fact that most general practice teams are struggling with morale and resilience. There's a real issue that we're having to significantly work hard to try and address the well-being of our staff, and that's everybody from receptionists, managers, clinicians. It's a very difficult time, and I think that's probably our biggest pressure at the moment, is trying to meet patient demand in the light of the fact that everybody's already exhausted.
Thanks, Caroline. It's a really, really important point. Robin, you want to come in, and then Neil, you wanted to come back.
Maybe Neil first, because it might be on that point. If that's Neil.
Okay, Neil.
First.
Yeah, I think Health and Wellbeing Board would sort of benefit from knowing how busy general practice is. So there was a A&E delivery board meeting yesterday, which presented probably that primary care is busier than it was pre-COVID, and is actually delivering more appointments and more consultation than it did pre-COVID. And so technology is having its great effect, and there may be frustrations with it, but it's actually creating a huge amount of demand, which they're doing great to sort of react to in the best thing. So whilst we've got some issues around sort of telephone access, when you get into the system, you know, the compliments we are getting about the service is really high. As you've sort of said, Tim, some of the use of the technology is really good. But I think one of the things we are really keen and working with is that resilience. We had the sort of the peak early doors, and for some people we've not come out of the pandemic, but the public has, and that's a perception we need to manage, and we need to ensure that there's support and like you say, the amount of contact that is going on is so much more than it was before, but it's still not meeting the demands. So, you know, I don't think we'll keep everybody happy, but work is going on to make sure access and timeliness, but also ensuring that in primary care staff are resilient and able to cope, and practices are able to retain staff to answer phones and answer queries. Because that's the main question. If we get a big outbreak, or if we get huge areas of sickness, then we will have issues. So it's a fine line at the moment, I think, in general practice, and they're managing really well.
Now, Robin, you wanted to come in?
Yeah, just 2 points. Thanks, Chair. First of all, I mean, I think the point Caroline and Neil made is really important about the whole system is experiencing real challenges in terms of well-being, capacity, and resilience, and I think that's across the whole health and care system, NHS colleagues in the local authority, but also our providers. And that might be good if Neil and Ian might want to speak briefly about social care, because social care and the social care sector is under incredible pressure as well. So I think that point's really a reality that we have to recognise, and I think some of the ability to still provide the care we are providing is really remarkable and should be recognised. And I think that includes the elective care at the acute part of the system as well, which has been incredibly resilient, although I know that there is challenges with backlog and pressures. The other point I think I should just mention, obviously there's incredible interest in the impact of restrictions upon the local authority area of Calderdale. And you'll have seen that we are tier 2, that the government introduced a new model. You'll have seen that a number of areas, of which ours is included, are in ongoing discussions with government, and we have further discussions in the next 24 hours on that. And we will urge everyone, as Debs has said, I think, to really consider and understand the restrictions. Hopefully they're simpler. For us in West Yorkshire, in Calderdale, most of West Yorkshire and Calderdale, we have been living with elements of this now for some time, since late July, in terms of the people mixing from different households. There is some elements of that where there is possibility to mix outdoors around the rule of 6, which could be a positive for our communities. But the self-isolation point, if people don't self-isolate, this will transmit and it will continue to escalate. And that is really, really a simple act that we know that not everyone is doing. It's critical. And I just urge everyone, with any influence you have, to urge people, if they're asked to self-isolate, to do so. Thank you. Thank you, Chair.
Thanks. Yeah, Ian, I just wondered if, and Robin, if I say something about providers, I just wondered also if you could say something about how we're making sure we keep the care homes safe from COVID. I know we've rehearsed this here before, but I mean, there's been some noise again nationally over the last few days about people being discharged from hospital into care homes. And, you know, I think it's just quite important that we understand as a system just what we're doing to make sure that that's done in a safe way.
I think I'm also getting my internet connections unstable, so I'm hoping you can hear me. If I just give you a little bit of an overview in terms of where we are with our care homes specifically at the moment, and I am going to touch wood, and that we currently don't have an outbreak in one of our residential care homes or nursing homes. We do have an outbreak in a community setting. And I think if I look back at the whole of the pandemic that we've experienced, in social care settings, we've had 14 outbreaks across the piece. And that's created some challenges and obviously some real difficulties for people who use services and people who employ them. But we have been a relatively low area for notifications of formal outbreaks. And I think that's testament to how both the authority and our partners, and particularly those social care providers, have worked tirelessly to really engage with really good infection control, really good use of PPE. You know, we've worked really hard to make sure there's a good supply of PPE. And I think that clearly has contributed to that lower number of notifications. Clearly going into winter, we're starting to work through how we'll continue to do that. And I think the piece that Carolyn talked about in terms of staff resilience, I know our care home providers and our care providers have not had any respite from what's often described as the first wave, moving into what we're seeing as now in real high community prevalence. So I think there's something about how we support the emotional resilience of our providers to continue to deliver, but also stay with that kind of preventive approach about reducing the risk. I think one of the challenges we're currently facing, and again is getting quite a lot of national attention, is the sacrifice that relatives have made in terms of not visiting their loved ones. The national guidance that we have says that care home visiting should not happen unless in exceptional circumstances, and that's broadly defined around end of life care. That has brought some real challenges for relatives and for residents and for the care homes themselves. And I think it talks slightly to the piece that we had on broader carers. So we are trying to have some conversations about how care home visiting could be facilitated, even in the context of high prevalence. And there are some possibilities that we might be able to introduce through the winter care visiting, but in very, very tightly controlled environments where it would be a named relative, it would be through a booking process, but also in a very COVID secure, with no touch points with the main body of the home, therefore limiting the ability for the virus to get into the home. And I think it would be inhumane not to listen to the voice of relatives on that piece. So I'd want to assure people that we are working through that, but there is no risk-free way of introducing care homes. But in the balance we have to draw is between protecting our older population in care homes, with that about the harm that might be caused by further extended periods of lack of contact. I think the other piece I just wanted to mention, which again I think talks to the carer piece, is that I think while some of the traditional services that carers might have accessed might have not been able to deliver their services the way that they have done, what they have done is adapted to the way in which they can respond. So for example, day services that clearly couldn't operate as a full day service, but what they've done is done outreach work into people's homes to provide that carer break and carer solution. That's not quite the same service that people had before, but I think there's something incumbent on all of us to kind of recognise that what we haven't done is closed services per se. They've had to adapt and be delivered differently. I think we are in for a very tough winter, and I think Anna and Neil have talked a lot about the health pressures. I think one of the challenges I think is recognising that our care providers are integral, like just as carers are integral to that delivery, and we need to continue to focus on protecting them. We are about to step up some of the additional capacity we had before, which I think might talk to Tim's question around some discharges where tests might not have been available. Our local place decision is that all people leaving hospital back into care settings will be tested. We do know that from time to time there has been an issue with the capacity to get that result quickly, which I think meant there was a slightly extension in the time results were gained. But we remain committed as a system that we will swab within 48 hours of discharge, and we won't discharge without a result. In order to manage that and make sure that people aren't staying in hospital further, if people will recall, we commissioned a number of additional regulated services to be very, for COVID positive patients where the result was known and a home was unable to take them back due to challenges in the home, but also where we're awaiting test results. So those services are coming back on stream shortly, and they will be subject to additional regulation. So one of the requirements of our adult social care winter plan that's national, but obviously is delivered locally, is that those designated premises will have to be further assured by CQC that they are COVID secure. So we are bringing online additional capacity, again, to ensure that the flow from hospital is appropriate, but protect homes where they're just not quite ready to take a resident back. I hope that helps.
Thanks very much, Ian. Yeah, that's really helpful. So I think what's set out there is the seriousness of the challenge and the looming pressures, particularly if the measures that are being taken to try and slow down the transmission rates don't succeed. And of course, what we know is the number of, on the basis of the number of cases already, we can expect the number of hospital admissions to continue to rise for a while, even if we hold the number of cases steady. So we mustn't underestimate the seriousness of this. I don't know if there's any further questions or comments on this, and I'm just very aware we've got 2 or 3 quite significant items and we're already 11:15. So are people okay if I move? Sorry, Stephen, were you waving at
Yeah,
me?
I'm trying to be very quick. Literally 20 seconds. What Deb said right at the outset is the most important thing, that individuals are isolating appropriately and those around them for 10 to 14 days. And often we're seeing, I'm sure Caroline will probably agree with this, people presenting into general practice. You ask a few questions and it's 7 days into the illness. And did you self-test? Have you tested? Have you isolated? No, I've just been doing everything else as normal. And you just obviously get very worried when you're hearing that time and time again.
Thanks. Yeah, Megan, yeah.
Thank you. Yes, I have taken the mute off. I think people have to remember that when things come to counsellors, they very rarely come to say, oh, isn't so-and-so doing a good job? They come when they think they've got an issue or have got an issue. And one of the things is once people get through to the GPs, it seems to work very, very well. It's just that it's a complicated, as you both admitted, it's a complicated process. I mean, I tried to do a flowchart thing for South Fareham, so it was simpler for people. But I got lost in the middle, so I'm still trying. But we're not always keeping things simple for people out there. Some of us might understand what the process is, but somebody who isn't really IT literate and is just doing it because they want to go to the doctors or they need to see a doctor, etc., they're not understanding where they should go and what they should do. So that's not a criticism of anybody. It's the way of the world at the moment. But the more we can support that and make the processes simple for people out there, I think it will help.
Thanks. I think we're quite keen to support through comms in all the ways we can to help get over those messages as clearly as we can for people. I noticed Helen nodding on some of those things. I won't bring you back. We'll probably come up under the involvement item later as well. Could I take us then to item 7B and the work that's been done on the impact of COVID on Black and minority ethnic communities? And I think, oh, I'm sorry, I've lost you, Kate. I think it's Kate. Yes. It's much easier when people have to sit in the same place around the table, isn't it, than when they keep dodging around the screens. It's the biggest frustration I have with Zoom. So Kate Horn from Public Health, thank you for introducing this item. I don't know if...
Yeah, that's fine. Yeah. Can you hear me okay? Because I keep getting the same note that says I've got an unstable internet connection, so I can turn my off if you can't. Can you give me a thumbs up if you can hear me okay?
Can hear you at the moment.
Great. I'll continue. So thank you for having me. I think Councillor Swift has introduced the item quite nicely. I'll presume that you've mainly read the report. So as a result of the evidence that appeared around the impact of coronavirus on our BAME communities and subsequently the restriction measures, in Calderdale we took action to engage with our local communities. And the things that we heard are there is a higher prevalence of long-term conditions associated with the poor outcomes of COVID, that many of our members of our BAME communities work in high-risk occupations with greater risk to the exposure, the lack of confidence in health and care services by family members, the impact of racism and discrimination in organisations and communities. And as we've evolved, that's still appearing in terms of our BAME communities being blamed for COVID. There are higher levels of poverty, poor housing and lower income in our local BAME communities. And I think that relates to the other point about access to primary care and services. If you're on a limited budget, you can't hang on to that phone, you have no technology. Challenges during lockdown, such as the skills in home educating children, and again, those skills in using technology to do that, if you are lucky enough to have that equipment. Concerns about protecting household members who are shielding and otherwise vulnerable, and that relates to Fatima's item in terms of trying to do that where you are caring for members of your family that are living in a multi-generational household with you becomes really difficult in terms of protecting them from potentially exposure to coronavirus at the same time. The exacerbation of unemployment caused by the restriction measures, and obviously that's increasing as we move through the pandemic, and the lack of trust in organisations and in the system from their repeated negative experiences. So as a result of that, what we found really, and obviously we're still engaging and the work is still evolving, producing with our stakeholders, including members of our community. And the action was split into 3 timescales: the immediate action to protect our communities from wave 1, to reduce the impact of the second wave that we're fastly going into, and additionally to address the root causes of inequalities in health experienced in Calderdale by our BAME communities. And I think we know that to ensure this is successful, we need to work together as organisations across the system and continue to work with our community. And I think to date, the success, I would say, of working with our community has really been down to our neighbourhoods team and all our community anchors and lay and peer members in the community. I do recognise Shabana Sadiq in this and Sales Simon for the work with the taxi drivers as well and with our places of worship. So in order to do this, in order to continue to work together, we're currently in a process of trying to establish a steering group, and that's really of enthusiastic, energetic people across the system who'd like to help drive the work forward. And what would be really great is if members of the Health and Wellbeing Board would like to be involved in that, and particularly it'd be great if we could have somebody as a member of this board to chair that steering group to drive the work forward and to ensure we get that accountability. So that would be fantastic as well. So as the work's evolving, it'd be great. I'm hoping we'll have many critical friends on this board if people would like to offer some input into that. And finally, it'd be really great, I'd be really happy if the board would like to receive ongoing progress reports on the work as well.
Thank you, Kate. A couple of volunteers to be involved already from Karen and Helen in the chat, so thank you very much for that. Perhaps can I first of all, as well as that, if people have any questions or comments on the findings and the action plan as well. I'm not seeing. Not.
Just Chair, just to say thank you to Kate. Just a thank you to Kate and also Helen and colleagues that were referenced. There's ever more keep the focus on this work. We will see the impact of what we are going through accelerating, and the impact will be exacerbated in our communities with the greatest levels of inequality. So thanks to colleagues. It's been support. We've been supporting others in this work, and it's really important. So thank you.
Thanks, Robin. Mike, you wanted to come in on this?
Thank you, Chair. I just wanted to say there has been a pre-discussion, and Anna Basford has agreed to chair the steering group and be the link into the Health and Wellbeing Board if the board would agree to that. That's it.
Thanks, thank you for volunteering, Anna. Pick that up. Yeah, I'll have a conversation with elected member colleagues. I'd like to have an elected member involved and on that group as well, but I'll pick that up and feed that in outside. That's okay. Any more views or comments on this? Pam, yeah.
Hi everyone. I just wanted to kind of highlight that at West Yorkshire and Harrogate we've done an independent review that came to an end last night, and that is looking at how we've supported our communities and staff through COVID, looking at 4 areas around high-risk jobs, BAME leadership, commissioning approaches and access to mental health. I just wanted to say thank you to Calderdale colleagues. They've really helped out with putting the insight packs together. There's a lot of good work that's going on. And I just wanted to say thank you for helping out and contributing to the West Yorkshire review.
Thanks very much, Pam, and thanks for your work on that, as well as Kate's work on this as well. The West Yorkshire Work's formally being launched next week and is clearly really important as part of this. Okay, I'm not seeing any more, so thank you very much. Thank you for that work, Kate. I'm sorry, Phil, with the time we've had on other items, we might spend a little more on this further on.
No, that's absolutely fine. Can I just say thank you to everybody who has been involved and everybody who's volunteered to get involved. That's brilliant.
Thanks, Kate. Ooh, thank you. Okay, thank you. Just bear with me, I've lost my agenda. Okay, item 8, health and wellbeing strategy updates, starting well. Julie, I think this has got your name against it.
Thank you, Councillor Swift. Yes, we said we'd bring today an update on starting well for you, and I've given you 2 documents. The first one I'm going to refer to are the terms of reference for the Starting Well board. Myself and Debs, myself as chair and Debs as deputy chair, have brought together the whole partnership so we can focus on starting well. And you'll know from our strategy there are a number of priorities that we've already set in there, which is around infant mortality, children being a healthy weight, school readiness, and dental health. And I brought you an in-depth report today on infant mortality, which I'll move on to shortly. You'll see from the terms of reference how important it is those first 1,000 days of giving children the best start in life. And we've had a peer review, which you are aware of, from February, and we just didn't want to miss the opportunity to make sure strategically, we are leading and driving the improvement that we need around this area. It is a big agenda, but I think we've got the right people around the table. So I have given you there the terms of reference and what we will be focusing on, particularly the first 2 years of a baby and a toddler's life is just so important, when their brains are like a sponge and they're soaking everything up. And we know if we get it right at the beginning, we are giving them the best chances to be healthy and not need specialist services, through their childhood or indeed as they grow up. I've brought you the first in-depth report, and we've done it in the style where we would have an overview of all the different elements, and you'll see from the data. I just want to just stress that clearly it's not up to date. It's a couple of years, and we're on a 3-year rolling average. We do have 2,000 live births in Colesdale every year, and to give you the number of deaths, as you'll see from the report, we're talking about 10 infant deaths. And at the moment, we've got 2 more child deaths than the England average, which is something that we want to work on. So I'd welcome the Health and Wellbeing Board comments and any input on some of the work that we're doing and what we're prioritising. If we look at preconception care for mums, we know we're helping them to give up smoking where we can. We're giving them lots of advice on breastfeeding. And clearly we've got active Calderdale. You know, we want mums and dads to be as active as they can be. We're trying to help people deal with their addiction, because we know if they're drinking and they're smoking or they're taking drugs, that is really going to impact on the baby's health. Nutrition, but also some genetic counselling as well for the families who may have some recessive chromosomal and genetic issues that could be passed to the baby. So what we really want to focus on here is preventable deaths as well. And you'll see that I have referenced the child death overview process. Every local authority area has a child death review process in place. And Ben Lehman is our representative on this and actually chairs that group, which sits under the Safeguarding Board. And I do think it's important to draw to the board's attention that we are picking up a pattern in terms of safe sleeping arrangements, and we're doing a lot of work with the community and getting messages out there about sleeping safely with your baby, because what we do see is some really sad you know, kind of issues where people may have had a drink, maybe taken some medication, they've had the baby in bed with them and they've rolled over. We also want to make sure that the baby's got a proper place to sleep, as I've said, not on a blow-up bed, you know, to be safe within a cot. So we are learning quite a lot from that process. Some of the priorities for us, you'll see from the report, are to reduce mums who are smoking at the time of delivery. We've done some good work on teenage pregnancy, which has helped bring our overall rate down over the last few years, and our breastfeeding rates are actually some of the best in the region. So I'd just like to pause there, Councillor Swift, and just open it out for any comments or questions or suggestions from the whole partnership. Are we working on the right things? Is there anything, you know, we've made some links there with child poverty and inequalities. Clearly, if you're living in a deprived household, you know, the rate of child death is unfortunately higher than it is in wealthier areas. So anything that anybody would like to add from the partnership in terms of scrutinising the data where we're at, and also the terms of reference for the Starting Well partnership would be very, very, very helpful. Thanks, Councillor Swift.
Thanks, Julie. Councillor Wilkinson, you wanted to come in.
Thanks, Tim. Yeah, I think I mentioned that, just emphasise the importance of this work at one of the previous meetings that we've had, and just the importance of having all partners on board with this work as well. And, you know, I think we had the early years review at the start of the year, and I think there was like a real commitment from everyone to drive this agenda forward. And I think it's just really important that we don't lose our focus now with COVID-19 and everything that's happening. In fact, I think it's actually more important, if anything, due to the pandemic. And we've heard a lot about children and young people falling back in terms of their development and education during the pandemic. And I think that the danger is that because we know just how much children's brains develop in the first 2 years, it could be this age group that possibly fall back more than any. And the danger is that it's, you know, the children from the most deprived backgrounds that fall back the most. But actually, I think you could well see issues across the board. I mean, speaking from personal experience, you know, I've got a 2-year-old, and rather than being in nursery for the last 6 months or with grandparents, he spent most of his time in the house with me and my wife, and both of us have got full-time jobs, and it's just been impossible for us to be able to give him the care and attention that he's really needed in those last 6 months at a really important time for his development, whilst also juggling all of our work responsibilities. I welcome the focus on infant mortality as well. I think it's timely, as it was Baby Loss Awareness Week just last week. And I know that we are slightly above average in terms of the numbers, although I see in the report that could just be a natural blip due to one particular year. And I also welcome the work that Julie's outlined in terms of smoking, teenage pregnancies, and co-sleeping. I have actually sort of heard conflicting things about what is told to parents in terms of co-sleeping from one authority to another, and had a friend from London who'd actually been advised that there are safe ways of co-sleeping. I know it can be challenging for parents in the middle of the night having to get up and try and settle babies, and the only way sometimes that it can actually be achieved is having that close contact with mum. So there is always that temptation, I suppose, just to get a good decent night's sleep, to just have baby in the bed alongside you. So welcome any comments on that, really, in terms of, are there safe ways of doing it, and is there differing of opinion on that? Because I've heard conflicting things, as I say, from other authorities.
Thanks, Adam. Do you want to take 2 or 3 comments and then you come back on them together? Because I think, Helen, you made a comment about the dental health now, which I noticed Julie's picked up in the comments. That's okay. Megan, you wanted to come in?
Very quick one.
Yeah, you're all right.
Oh, no, I didn't know. I thought you were just going round saying who did. Sorry. Very quick one. Can I ask you, is this going to work just about the same way as the trust worked, going back the way, where all partners were there, etc., and we stopped doing it for some reason? Probably something to do with the probably something to do with instructions from government, but it was a useful meeting, and if this can be as useful, it would be really good.
Thanks. Yeah. And Pam, you just made a comment in the chat about the Born in Bradford work, which is useful to comply. So, Julie, if you want to come back on a couple of those things?
I will do. Thanks, Councillor Swift. Yeah, I think the issue with safer co-sleeping is kind of what you've got in the bed with you. And I agree with Councillor Wilkinson, that kind of physical contact and the bonding and the kind of soothing is so important. And there is some advice that if the baby is in bed with you, in terms of your pillows and your sheets and your blankets, of trying to keep it away from the baby, anything that can obstruct the baby's breathing. There's a lot of advice about which way the baby should sleep, and the only way you can guarantee really how, if you put them on their backs and they're in the cot, they're there. I think the issue is often when we see in some really sad cases is where the baby has fallen and got trapped and rolled in the night. And I think even if you're, that you haven't had a drink, you haven't taken any drugs, you're completely compos mentis, you fall asleep, if your baby rolls with you, rolls down the side of the bed and the wall or down the side of the sofa, I think it's just safer overall if you can, to do the feeding, to win the baby and put the baby, if you can, back in their own bed. And if it's in bed with you, that you're as awake as you can be. I think you can do everything you can to reduce the risk, but I would advise, if possible, I think the baby should be in its own sleeping arrangements. I don't know whether you want to add anything to this, Debs, at all from a public health point of view, or are you okay with what I've said?
Sorry, Debs, you? Okay.
Justin,
I was saying I agreed. Sorry, Chair. I was saying I agreed with everything Julie said.
Yeah, you froze suddenly. Sorry, back to you, Julie.
I thought you were just having a sip of your tea. And just to go back to Councillor Swift's comment and question around the kind of partnership arrangements. What we've done, Councillor Swift, is said, this is so important, this starting well, this best start in life for our children, that we really want to focus on those 4 priorities that I outlined. I think we'll review them, with the Health and Wellbeing Board and make sure they are the right ones. They're the ones we focused on for now. That may change. We may say something else is more important. I think the school readiness is really, really important, that we agree a definition and we all know what we're aiming for when we're talking to nurseries or school. What are we talking about when we say to a parent, like Councillor Wilkinson, we want your little boy to be ready for school? What does that mean? We've kept it and honed it really down on those 4 areas at the moment, because we've got really good emotional health and well-being arrangements in place. Dr. Caroline Taylor and other colleagues are really leading all of that work, and we don't want to encroach onto that space about emotional well-being. So we're trying to keep it as tight as we can do. Yes, it is like a children's partnership, because we have got really good attendance and buy-in there, as Councillor Wilkinson said, which is great to see. So we're going to focus on that early start. We've got the safeguarding partnership that's already in place, as you know, to make sure things are safe. We've got a partnership around emotional well-being, and we want to drive that starting well agenda with the right people around the table. But at the right time, Councillor Swift, it'd be good to bring it for review to say, are those priorities still relevant, and do we need to refresh them at all?
Thanks very much. Thanks. Just on the child death ones, which we touched on a bit. I mean, it is where it's very hard, because obviously any child death is one too many anyway. The numbers, thankfully, are very small, so actually quite small fluctuations can distort it. But it is a bit of a worry, because I remember we were an outlier in the going back to 2010, 2012, 2013, and focused quite a lot of time at then, and we come back to the average. And I think understanding why that's happened again, whether it is just a statistical blip, because as I say, the numbers are quite small, so you have to be careful. But I completely understand that needs to be a priority, and sometimes it can be an indicator, of course, of wider issues, can't it? So I think it's absolutely right. I'm not seeing anyone else on that. I noticed the comment about dental health. We can enjoy ourselves on a debate around the issues there, and the time perhaps. Sorry, Julie.
Yeah, I've got a detailed report of that as part of the work, so I can table that at a future meeting when you would like, when the board would like.
Thank you. I remember a council meeting very many years ago when Councillor Baines and I were the only 2 councillors to support fluoridation, but we won't start that debate today. Okay, are people okay then if I move us on to item 9, which is the Involving People update? And I think, Helen, I think you're introducing this.
I am, yes, thank you. Although I feel like it's hard to follow a comment about fluoridation. So you've obviously had a number of different reports that sort of sit underneath this agenda item. You'll remember that at the start of this year, before everybody's time was taken up by something else, we did an informal meeting of the Health and Wellbeing Board, where we focused on how we could involve people more in the work of the board. And we had a number of different areas that we discussed as part of that. And at the end of that session, we had a brief presentation from Jill and Simon at the CCG, who introduced us to an Involving People strategy. So what the agenda item does today is it gives a bit of an update in terms of work around that follow-up work from that informal session. It gives Jill and Simon an opportunity to update on the Involving People strategy and to ask for the board's support with endorsing that strategy and involvement with it. I'm going to give a bit of a live example of COVID engagement work and how we've worked in partnership to be able to engage with the public. And then I'm hoping that Mike might be able to offer us just a couple of bits of information about how things are progressing around Calderdale conversations. So what I'm hoping is that we'll get through that quite quickly, and then we'll have an opportunity for people to ask questions at the end of that rather than breaking off in the middle. So I'm just going to start by kind of giving an update from the Informal Health and Wellbeing Board. There's a report in the pack that actually came to the Health and Wellbeing Board in August, but we didn't get the time to perhaps look at it in full. And I think being mindful of the fact that our situation has changed quite substantially since we actually talked about how we might involve people more as a board, actually a lot of the things that were suggested aren't currently feasible. So we talked about hosting the meeting in different locations across Calderdale. We talked about having meetings where the public could come in and just talk to sort of senior leaders in the health and care system to kind of try and bring people's voices in more. Obviously, that sort of thing isn't something that's feasible to do right at this moment. So I've worked with Alex, who wrote the paper, and with Mike to look at how we might be able to adapt what we'd suggested, and there's an action plan that you can look over and comment on. We have said that it wouldn't be appropriate to have an action plan to involve people without actually involving any people in what that action plan looks like. But we are very mindful of the fact that saying, what do you think of this action plan, is not the most exciting thing for people to comment on. So we've looked at perhaps different ways. I think it's under section 3.7 in the report, different ways where we might be able to ask people for their views on how they could get more involved. And we're kind of working up how that will be. So I think there's a number of recommendations in that report, most of which are about kind of getting the Health and Wellbeing Board's approval to start work on some of that action plan. But I think perhaps if we come back to the recommendations at the end and check where the board is at with that stuff, that would be really, really helpful. What I will do now is I'll hand over to Jill and Simon to talk through some information about the Involving People strategy. Carol, do you have the slides available to share, or are you wanting one of us to do that?
Hello there. It's easier if one of you do that, please.
That's fine. I'll share my screen if I can find the item. Apologies, I'm just getting the right thing open.
I've got it handy if that's helpful, Helen.
It's all right. I think I've done it now.
You have.
Simon, Jill, could you take over from me now?
Of course, yes, thank you. Hello, everybody. For those of you who don't know me, my name is Jill Dufton. I'm the engagement lead for the CCG. Myself and my colleague Simon, who's the comms lead for the CCG, are here to talk to you very briefly, given I'm aware of the time, about the Involving People strategy and how we're proposing to work together with our partner communication, engagement and equality teams. Hopefully you've all had sight of the strategy, so I'll just briefly go through a couple of slides. The Involving People strategy it's a shared set of principles for involving people across Colesdale, which will support the delivery to Calderdale Cares and Wellbeing strategy. We know by experience that the only way we can make sure that health and care services we provide that are right is through involvement through local people. The strategy describes a narrative for involving people and supports the way of working that we can use as a joint approach with some shared principles. Back in January, myself, Simon and Lucy, the lead for comms at the council, presented in more detail the Involving People strategy and the approach to communications and engagement that we're suggesting. Obviously with a view to coming back March, April time to the public meeting, but unfortunately due to COVID it was delayed, which is why we're here today. Calderdale Cares is a community-led approach for delivering health and care services in Calderdale, and our aim is to create strong collaboration across Calderdale, where organisations such as the NHS, the council, voluntary community sector can work together to share these resources and deliver a range of support to meet each person's individual needs. This approach will mean that community health and care services, including primary care, public health and social care services for adults and children, will work together more closely. In order to support delivery in Calderdale Cares and the Wellbeing strategy, we've been asked to look at a common approach to communications and engagement, which is why we're here today. So this is not about centralising control, but it's about allowing us to make the most of our skills and knowledge and resources to deliver those shared objectives and effectively share all the wonderful work that we're all doing. So a little bit about the involving people strategy. Next slide, Helen, sorry. So a key priority during 1920, which seems so long ago now, for the CCG's engagement team and our partners, was the development of a new system-wide strategy to involving people in Calderdale. The strategy is a shared set of principles for involving people, and it's been developed in partnership with partners including the local authority, the VSI Alliance, North Halifax Partnership, Health Watch and our providers. It's also been tested with public audiences such as the Calderdale Health Forum, which is a group of patient reference groups with our GP practices, children and young people in the local authority as well. As I said earlier, we came to the Health and Wellbeing Body back in January to talk about it in more detail, and it has been shared over quite a few months in its development process with the what was the Health and Wellbeing Development Group, the CCG Government Body Development Session, which was had an extended invite, I believe, and also to yourselves at the Health and Wellbeing Board. So all partners have seen the strategy and have had an opportunity to comment, and we've gathered all those comments and views to develop what we are presenting to you today, which is the draft strategy. And hopefully, as I said earlier, that you've had a chance to have a little look through. So public sector organisations all have different requirements for involving local people in the design, development and implementation of services. So we will need to adhere to our own, however the principles of the strategy still apply for us all. The purpose of the strategy is to create a framework for involvement. It's not intended to create new mechanisms at all, but just simply use the resources that we already have in place to create an integrated approach. The vision is to transfer resources and identify opportunities to develop the skills with local people so that any future strategy can be developed by local people for local people. It's also intended to create a platform for sharing of knowledge, information from both services to communities and communities to services, and also the relationships that services have with local people and that local people have with services. All partners in Colesdale have a range of methods and approaches in place to involve local people, and the strategy will create opportunities to build on these existing approaches and maximise our resources by continuing to strengthen an approach involvement with our population and opportunities for meaningful involvement. There are 3 enablers to support this strategy, which are communication, firstly in relation to involving people more widely in how and when we communicate with our audiences to prepare them for conversations that will take place, equality to ensure that we reach our diverse communities, and patient experience or people's experience, so using people's stories and sharing and learning from them. Next slide, Helen, sorry. So hopefully you've all received this slide too, which this is a slide that how we're proposing that we can work together with our partner engagement, communication and equality teams. So I'll start at the bottom of the slide and work my way up. So individual organisations all have individual engagement and communication teams within the partnership, all our partners. And we'll continue to lead on our own engagement, our own communications and equality in line with our statutory duties and legal obligations. As partners have our own legal obligations, we will need to describe our own internal governance and assurance processes too. But the strategy will use the CCG will use a strategy as a vision to describe our legal obligations and our governance and assurance methods and approaches, and we will put these on our website and they will accompany the strategy. Other partners may want to do the same. And then we are suggesting that we have a system-wide or a place-wide of Colesdale collaborative engagement and communication and equality professionals. So we've already got an involving people network within Calderdale and the beginnings of a comms network, and we'd like to bring these together along with our equality colleagues to establish a group of professionals so we can use that knowledge, skills and resources to coordinate and deliver any system-wide projects as a place in Calderdale. And then we have the Calderdale Collaborative Community Programme. I think the slide that you have may say commissioning. I think there was some confusion about the name of the of this board, but it's been confirmed it is community. So apologies for that. This group would be responsible for the operational delivery of the collaborative, the Comms Engagement and Equality Collaborative, and day-to-day updates and sign-off materials and messages, plans, etc. would go here. And then ultimately the Health and Wellbeing Board, who hold the responsibility for Calderdale Cares and the wellbeing strategy. Next slide, please, Helen. So in order to take this forward, we would need to establish a collaborative of comms engagement and equality professionals from each of the key partner organisations. We will of course need terms of reference and a work plan. The idea is that we would meet regularly to have the opportunity to share views, knowledge, skills and resources. We would have advanced awareness of communication and an engagement working across Calderdale. The leads would come together to facilitate system-wide projects, involvement or campaigns that do once approach. So we're working together and integrated rather doing things separately. We've already got, as I said earlier, a diverse involving people network with lots of skills and knowledge to support the collaborative, who can help share timely and consistent messages and also support involvement opportunities to help us reach our diverse communities and localities. And the COVID-19 engagement that I think Helen will be touching on is a really good example of how we've worked together over the last few months and brought the strategy to life. Next slide, please, Helen. So the next steps would be, as I said earlier, to establish the Comms Engagement and Equality Collaborative. This would include developing ways of working, the purpose of the group, terms of reference and a work plan. We would also need to work how we would work with the Calderdale Community Collaborative Programme Board to understand reporting mechanisms and links to and from the Programme Board. And we will also need to understand reporting mechanism back into our own individual organisations too. And so the recommendations for the board are to agree and endorse the involving people strategy and the governance arrangements that have been suggested, and that board members agree to ensure that communications and engagement and equality representatives from their organisations to be involved in the collaborative, so we can start to take things forward and start working integrated and a do once approach. And I'm really sorry I've probably rushed through that, but I'm just really mindful of time. So I hope that that all made sense.
Thank you, Jill. Really appreciate that. I'm really mindful of time as well. And so I want to give you like a very brief overview of how we've actually done some work together to engage the public during the COVID-19 pandemic, using the Involving People Engagement Network that Jill's already mentioned, who worked together to develop the project plan that was led by Healthwatch and worked together to develop the survey in order to capture people's views on their health and care experiences during the pandemic. So I wanted to give you a little bit of insight about how that had worked, as well as giving some key themes from that engagement, but I'm mindful that there is nowhere near enough time to do that. What I do want to say is that we have been doing some work through that network to map the engagement that's taken place in Colesdale during the pandemic. So at the moment, we are gathering back in learning from the different pieces of engagement work that different organisations have done across Calderdale during this time. And we're trying to bring in that learning at the same time as sharing the Health Watch report that's kind of been branded up under Colesdale Cares because of the involvement of all of the different partners. Whilst we're sharing that, we're actually trying to bring together the diverse range of learning that's taken place at this time. So perhaps there's space on an agenda in the future to bring together both what learning came out of this piece of collaborative engagement work, but also learning that's come out of the various different pieces of engagement work that have been done. I think at the moment there's 25 pieces of work on that list. And that list is always expanding, and there's going to be some a summary of that feedback on the Calderdale Conversations webpage. So I don't think I'll go into any more detail than that, and I'll stop sharing my screen because I'm aware that there's already some people requesting to comment. I don't know, Mike, if you would want to give any sort of brief indication around what's coming next with Calderdale Conversations.
If it's okay with you, Councillor Swift, given the time, I can do a written update for members of the board.
Yeah, that might be helpful if you don't mind, actually, because we've two other items after this and we're losing people. So I do apologise for that. Neil, you wanted to come in.
Yeah, thanks, Tim. It was just recognition. This is really good work as what we're doing across partnerships and fully support the sort of strategy. It was just a bit of a plea, I think, to other partners around the doing it once thing. And I'm conscious that we get health and wellbeing, Health Watch reports, but then every individual organisation responds. And actually, do we actually need to start thinking about we respond as Calderdale to that rather than just the CCG, the trust and whatever? And I'm conscious there's a report out at the moment where we probably need a bit of a pulling it all together. So it's just, do people sign up? So we actually try and start to sign up as a Calderdale response rather than a trust, council or CCG. And I think it'll just put it as another step forward into that, working as Calderdale, because this is all showing really good worked up stuff. And I think that would just really help and be more powerful.
Yeah, thanks. Deb's agreeing with that. I think that's a logical next step, isn't it? I think that was the conversation we were having before, that we started off with talking about, health and wellbeing boards involvement, but then we've got other bits of involvement. Actually, people out there don't experience all these different organisations and parts. They experience health and care, and we want to deal with it as one, not as all these different elements. And I know it's not easy because we've all got our organisations' boundaries and expectations, but I think this is an important step forward, and I'm sorry we've perhaps not had quite enough time to do it justice in the way that we would want to. Is there anything else anyone wants to pick up on the items in here? So I recognise the work that's been done because we've had a couple of goes at this that has moved forward quite a lot. So thank you, everybody, for the work that's been done to date. I think you can take this as broad endorsement of the direction of travel. But obviously people might want to feedback detailed ones. If Mike could provide that note on Calderdale Conversations, that would be great. Thank you. So I am aware that we're losing people. I mean, the problem with Zoom meetings is you don't have walking time in between to catch up, do you? So you have to go straight from one to the other. So thank you everybody for the work that's gone into that. And yeah, absolutely, the commitment is for our teams to work together on this. So thank you for that work. I've lost my agenda. So if I move on, thank you. Item 10, implementing Calderdale Cares next steps. Is this
me, Chair?
Yeah, sorry, Debbie. Can't see anyone on the screen. Everyone on the screen, I lose track.
I'll do this really quickly. This is just a pull together of work and thinking from myself, Ian Baines and Debs. You'll be aware that we had an ask from the board to kind of move forward with integration, which is really moving forward with Calderdale Cares in essence. So we've just pulled a paper together, just talks about the journey so far, and really, I guess there's just two things to pull out. One is we've got now what is a compelling narrative that we've been thinking that we need for our starting point to be able to describe the reason for this journey. So what difference is it going to make to people in Calderdale? So that is that's set out in section 3, and then there are a series of next steps in the end section, which just talk about the more transactional activities that we're planning. Given the time, we could absolutely take email contributions or questions about that. But what we wanted today is just for the board to see the narrative and for us to receive any comments perhaps in the next week or so, and then for us to be able to progress on the basis that that narrative is something that everybody's happy with. And I'll leave it there to see if Debs or Ian want to say anything.
Thanks very much. I'm not seeing anybody indicate. Again, this does come out of quite a lot of earlier discussions. And again, wary of it being a rushed item, but I think we're happy as the direction of travel and people can feed in. Debs, yeah, you want to come back?
Sorry, I said I didn't want to say something, and I've just remembered. Just to say that, the vision, the sort of narrative is really based on the outcome of all of the engagement that's happened today on Calderdale Cares. So it's not sort of plucked out the air. It's trying to pull together a lot of what communities have told us, and also what staff have told us is important. So just so people are aware, that's the sort of background of that.
Appreciate it. Yeah, thank you. Okay, so we're happy to go forward with that one. I'll take us on then to item 11, the hospital reconfiguration. I mean, you might think it's this rather large item to have as the last item. It was brought here largely just to brief people and make them aware of where they are, rather than for substantial discussion, because I think that's taking place in a lot of different places. But Anna, do you want to introduce this briefly for us?
Yes, thank you. I'd fully agree. This document that's been shared today is for information for members of the Health and Wellbeing Board. It mirrors the document that was recently presented at a public meeting of the Joint Scrutiny Committee, the Calderdale and Kirklees. I think it's self-explanatory, setting out timelines for investment into both Calderdale Royal Hospital and Huddersfield Royal Infirmary. I'd be very happy for any member of the Health and Wellbeing Board, if they'd like to have a separate conversation and require any additional detail, I'd be very happy to do that.
Thanks very much, Anna. I think it's important it's shown that it's been here as well, so people are aware and people will take that up. And recognising that we're losing people at a rate of knots, people are happy to simply receive that then, and obviously again, if people have got comments, please to feed them in. Thank you. Lost my agenda. So I think that then leaves us with the forward plan, which has been circulated. There was a suggestion in the comments that we might want to have the report that Helen, the Health Watch, has done on people's experience of health of COVID as an agenda item for a future meeting. I think that would be, that would be good. Mike, is there anything else to add on the forward plan?
Chair, the only thing to do is to remind members that we have an informal board meeting on the 12th of November, which is looking at climate change and health. We're working with Stuart Sugarman and someone whose surname I can't remember, but Alexis, who works for Yorkshire Ambulance Service, who's done some work on this work. We've also done a trawl of other local health and wellbeing boards, and Leeds have done some work on this, and we're meeting with one of the support officers from Leeds to see if we can learn from her. Alexis Keach, I understand. Yeah. Okay,
thanks very much. So we have a date for that, and then the formal meeting is quite close to Christmas, if we're having Christmas this year. So if we can look at when's appropriate to bring the Health Watch report and add that to it. So I think with that, that concludes. Thank you everybody for your time and contributions this morning. I'll close the meeting. Thank you.